To mandating shots, some medical professionals are fighting back against rolling up their sleeves. News 4's Gabriela Vidal dives into their message to lawmakers.
By September 15th, BJC employees will all have to be fully vaccinated against COVID-19. For Mercy and SSM Health employees, they'll have to do the same by the end of September. But a growing movement of people against vaccine mandates is calling on lawmakers to change that.
Honestly, it absolutely terrifies me.
Brittany HARTZELL is a registered nurse working at Mercy Hospital in Springfield, but says Tuesday will be her last day on the job because she doesn't plan to take the COVID-19 vaccine.
I pride myself on being an advocate for evidence-based practice, doing my research as far as answering questions for my patients and things like that, and there just wasn't enough information to make me feel comfortable getting this.
It's what led her to creating Take a Stand Now Missouri, an organization calling on lawmakers in the state to prevent employers, especially hospital networks, from mandating the COVID-19 vaccine on staff.
We have legislators on our side that want to stand up and get a mandate or get legislation going that would stop the mandates.
She says the group is not anti-vaccine, but wants employees like her to have the choice to make a decision based on scientific evidence.
I just don't think I should be forced to take something that is experimental and doesn't have the efficacy that we want it to.
Dr. Clay DUNAGAN, BJC Healthcare's chief clinical officer, says claims COVID-19 vaccines are experimental and lead to dangerous side effects are unfounded.
That, of course, was obviated by the FDA's decision on Monday to license the product. They've now concluded that there's sufficient evidence to say that these are safe and effective drugs and they can be used.
DUNAGAN says only a handful of people within the BJC healthcare system were admitted for allergic reactions to vaccines, and ultimately the community's hospital system is still seeing an overwhelming majority of unvaccinated residents in hospital beds.
The bottom line is all of us who go into the healthcare professions are sworn to an oath to first do no harm to our patients, and part of that includes taking necessary steps to prevent communicable diseases being introduced.
HARTZELL, who plans to take a medical role outside of the state, says she believes other medical professionals like her will choose to leave because of vaccine requirements.
I don't want to encourage anyone not to get it. I just want them to look at everything they can before making that decision.
Protest against vaccine mandates is set to take place on September 11th at the state capitol. Gabriela Vidal, News 4.